when Nottingham University Hospital's NHS Trust recorded 11 never events in theatres over 2 years in 2010 to 2011. The impact was devastating. Internally, it felt like we were letting our patients down despite a highly motivated and very well trained workforce. Externally, we had a lot of pressure from our commissioners and CQC, the UK healthcare regulator. People said that never events were a misnomer, they are just part of surgical life. But taking our cue from Professor Mary Dixon-Woods, we made a conscious decision that surgical harm, and never events in particular, aren't just part of life, they are a social problem, and they are a problem with a solution we set out to find. Our response was an ambitious 3-year strategy of 3 interwoven streams: building a safety culture, understanding and learning, and education and training. We needed to create an open, responsive culture, a culture where all staff feel trusted and respected, where excellent teamwork is the norm, where staff are aware that there is always more to do, and where leadership is shared. We have a strong focus on visible leadership and safety. We have the full support of our Chief Executive and the Board. We've created a trust-wide safe surgery group to oversee our programme of safety work. We've worked hard to understand what our staff think about safety at NUH. Formal safety climate studies were completed by over 800 staff. These data go back to the individual teams. Every team works together to produce a plan which reinforces all that is good and has concrete measures to address areas that need to improve.
Understanding and learning from incidents is a challenge for any organisation. We have focused on 3 things: reporting the incidents, investigating the incidents, and making sure we share the learning with all of our staff. We've seen the number of reported low harm incidents rise. We have a responsive cascade of learning using a variety of methods. Our colleagues are supported to find novel solutions to problems.
So I'm theatres pharmacist, firstly by learning by our mistakes and trying to prevent them happening again. We also look at innovative ways, so I've actually looked at trying to design a tray for how when anaesthetists are drawing up drugs and how they lay out their drugs prior to going into theatre.
Traditionally, the focus of education and training has been on knowledge and technical skills. We have built on these strengths by weaving a practical understanding of human factors into our programme. It's not an add-on afterthought. We strive to make it a way of thinking. Lil Rank and Lioko describe healthcare as a continuum from standard and routine procedures to the unexpected and non-routine. The messy world of emergencies, complications and insufficient information to make a certain diagnosis requires clinical experts working in a strong, supportive team. But much of what we do is standard or routine, and approaches to reduce variation, such as standards and guidelines, are drivers of improved patient care. Using the wrong approach in the wrong situation is a recipe for conflict, disengagement, and unsafe care. A key aspect for us is improving safety behaviours. There is no single magic bullet, but some of the factors we believe are key include our network of safety champions, mandatory training for pivotal practices such as the WHO checklist, a programme of in situ team training, and time out for all our staff at our annual safety conferences.
Every theatre has a safety champion. They attend a bespoke training programme around theatre safety. They reinforce key messages and themes with their teams, as well as bringing local concerns to wider attention.
It would be the 5 steps to safer surgery. It's just making sure that no mistakes happen.
The biggest challenge is implementing the changes. As a whole, people don't like change, and it's hard to get a new message across to a whole team.
We're all leaders in safety, you know, it's everyone's responsibility.
After seeing the video presentation, they've realised some of the mistakes that were made in the earlier times when it first came about. before we would do a case and then you wouldn't get the debrief and find out what's happened or learn from our mistakes.
We will leave you with 3 questions. Do you know what the safety culture is like in your organisation? Are you learning from your incidents? And how are your staff learning about positive safety behaviours?